Hello, today we are going to talk about chapter 18, which is covering hygiene. We will also make sure that I want you to go over your objective, the key terms, the definitions that you will be studying now, and the key abbreviations if there are any abbreviations in this chapter. Know your skills with this chapter also. Focus on communication, focus on rehabilitation. Make sure you go over the boxes and tables and figures. Also, read on dedication guidelines, review promoting safety and comfort, review residents with dementia if it's in there, review procedure, caring about culture, teamwork, and time management, time to reflect, and the quality of life. Quality of life is in every chapter. And then also after you have studied and read and taken notes, take the review questions at the back of the chapter and then check your answers. Okay, so now we'll go ahead and get started with the meat of the chapter, hygiene. Hygiene promotes comfort, safety, and health. Intact skin is the body's first line of defense against disease. Prevents microbes from entering the body and causing an infection. Good hygiene cleanses the body, prevents body and health odors, is relaxing, and increases circulation. Mucous membrane of the mouth and genital area and anus must be clean and intact as part of the body's defense against disease. People's preference about hygiene vary. Some people take showers, others take tub baths, some bathe at bedtime, others bathe in the morning. Bathing frequency also varies. Factors that affect hygiene. Culture and personal choice affect hygiene. Many factors affect hygiene needs. For example, perspiration, elimination, vomiting, drainage from wounds or body openings, bed rest, and activity. The nurse uses the nursing process to meet the person's hygiene needs. Follow the nurse's directions and the care plan. Some older person resist your efforts to assist with hygiene. Illness and aging changes can affect self-care abilities. Some people need help with their hygiene. Daily care. Assist with hygiene whenever it is needed. Protect the person's right to privacy and to personal choice. Daily care is given at these times: before breakfast, early morning care or AM care; after breakfast, morning care; afternoon care. You also have evening care, PM care. Most people have hygiene routines and habits. Hygiene measures are often done before and after meals and at bedtime. Night shift and day shift staff members give AM care. They get residents ready for breakfast or morning tasks. Morning care is given after breakfast. Hygiene measures are more thorough at this time. Afternoon care is done before the person takes a nap. The has visitors or attends activity programs, and evening care is relaxing and promotes comfort. Oral hygiene helps the mouth and teeth stay clean, prevents mouth odors and infections, increases comfort, makes food taste better, reduces the risk for cavities, dental caries, and periodontal disease. Before providing oral care, be sure to check the resident's identification, ID. The nurse assesses the person's need for mouth care. The speech and language pathologist and the dietitian may also do the same. Illness, disease, and some drugs often cause a bad taste in the mouth, a whitish coating in the mouth and on the tongue, redness and swelling in the mouth and on the tongue, or dry mouth. Dry mouth also is common from oxygen, smoking, decreased fluid intake, and anxiety. Oral care continues with flossing, removes the plaque and tartar from the teeth, removes food from between the teeth, is usually done after brushing, and you need to floss for persons who cannot do so themselves. Plaque is a thin film coat that sticks to the teeth. It contains saliva, microbes, and other substances. Plaque causes tooth decay. When plaque hardens, it is called tartar. Tartar builds up at the gum line near the neck of the tooth. Tartar buildup causes periodontal disease. Periodontal disease, which is gum disease periuria, is inflammation of the tissue around the teeth. Gums are red, swollen, and bleed easily. As the disease progresses, bone is destroyed and teeth loosen, and tooth loss is very common. Plaque and tartar build up from poor oral hygiene. Dental floss is used to clean between the teeth to prevent periodontal disease. Some people floss after meals. If done once a day, bedtime is the best time to floss. Some people perform oral hygiene themselves. You may need to brush the teeth for persons who are very weak, cannot move, or use their arms, are too confused to brush their teeth. Some people need to help gathering and setting up equipment. Here you see an oral hygiene for the unconscious person. You will also see the setup of patting a tooth blade so you can do oral care. The purpose of it is to help protect keep the mouth open while you clean the mouth with the swabs. Make sure the unconscious person's head is turned well to the side to prevent expiration. And making that padded tongue blade, as you can see, you place 2 wooden tongue blades together. You wrap gauze around the top half and tape the gauze in place and make sure it's very secure so it will not come apart. Oral hygiene, the supplies, you need a toothbrush, toothpaste, dental floss, and mouthwash are needed. Persons with dentures need a denture cleaner, denture cup, and denture brush, a toothbrush. Use only denture cleaning products to avoid damaging the dentures. Sponge swabs, they will provide that also. With the sponge swab, check the foam pad to make sure it is tight on the stick, and the person will not choke on the foam pad if it comes off the stick. Okay. Slide 12, you'll see there's the adaptive devices for hygiene. For A, there's a tooth squeezer for the toothpaste. B, you have the wash mitt holds a bar of soap. C, a tap turner makes round knobs to make them easy to turn. And D, a long handle sponge is used for hard to reach body parts. These are really nice devices to have for the clients. The unconscious person, the care plan tells you what cleaning agent to use. Protect unconscious persons from choking and aspiration. Keep the person's mouth open with a padded tongue blade. Always assume that unconscious persons can hear. Mouth care is given at least every 2 hours for that unconscious individual. Follow the nurse's directions and the care plan. Oral hygiene keeps the mouth clean and moist and helps prevent infection. Aspiration is breathing fluid, food, vomitus, or an object into the lungs. To prevent expiration, position the person on one side with the head turned well to the side to allow excess fluid to run out of the mouth. You'll see that in figure 8.5. Use only a small amount of fluid to clean the mouth and do not insert dentures. Apply a lubricant to the lips when you are done to keep the lips from cracking. Unconscious persons cannot speak or respond to you. However, some can hear. Explain what you are doing step by step. for that reason. Hygiene still continue on. Denture care. Mouth care is given and dentures cleaned as often as natural teeth. Dentures are slippery when wet. Dentures easily break or chip if dropped onto a hard surface, so always make sure you have a good grip. To use a cleaning agent, follow manufacturer's instructions. Hot water causes dentures to lose their shape, their warp. Remind residents not to wrap their dentures in tissues or napkins. You clean dentures for those who cannot do so. Many people clean their own dentures. Some need help collecting items used to clean the dentures though. Full and partial dentures are common. A full denture replaces all of the upper or lower teeth. With a partial denture, the person has some natural teeth. If not worn after cleaning, store dentures in a container with cool water or a denture soaking solution. Otherwise, they can dry out and warp. Dentures are usually removed at bedtime. Some people do not wear their dentures. Others wear dentures for eating and remove them after meals. Flossing, you will see that you see how the floss is wrapped around the middle fingers. And B, the floss is moved in up and down motion between the teeth. Floss is moved up and down from the person's crown to the gum line. Here you'll see the denture cups where you have A is the partial denture and B is a full set of denture. And that's the denture cups that you will put them in cool water so they will not warp. Cleaning denture care, make sure you have a gauze that will pull. You can pull the dentures out so you can hold on to them tightly so you won't drop them because they are slippery. Cleaning the dentures, as you can see, remove the denture by grasping it with the thumb and index finger of one hand and use a piece of gauze to grasp the slippery dentures. Even when you're cleaning, make sure, of course, you're going to have your gloves on and make sure you hold those dentures like they have in A and B where they show you. And brush the teeth just like you would brush your own teeth, going up and down with the motions. A different equipment to give a bath. Shower chair is in the shower stall. You have another shower cabinet and shower trolley. The sides are lowered for transfer into and out of the trolley. Bathing, you want to cleanse the skin, cleanse the mucous membrane of the genital and anal areas. Is refreshing and relaxing. Circulation is stimulated and body parts are exercised. Observations are made. Make sure you observe any bruises, cuts, abrasions, or anything like that, rashes. You have time to observe all of this at this time. And microbes, dead skin, perspiration, excess oils are removed during bathing. In nursing centers, bathing usually occurs after breakfast or the evening meal. The person's choice of bath time is respected whenever possible. And as you can see that during the bathing part, complete and partial baths, tub baths or showers are given. The bathing method depends on the person's conditions, self-care abilities, and personal choice. Thorough rinsing is needed when using soap. Oil, lotions, and oils help keep the skin soft. Here you'll see making a mitted washcloth. In A, you see how the hand is positioned to make that cloth. You want to grasp the near side of the washcloth with your thumb And B, bring that washcloth around and behind your hand. And then you will follow up and fold the side of the washcloth over your palm as you grasp it with your thumb. And D shows where you'll fold the top of the washcloth down and tuck it under next to your palm. Bathing frequency is a personal matter. Older persons usually need a complete bath and shower twice a week. Dry skin occurs when aging and is easily damaged. Soap also dries the skin. Bathing procedures can threaten persons with dementia. The complete bath involves washing the person's entire body in bed. Washing the eyes with a mitted washcloth. You see how the arrow goes. You wash white from inner to outer aspect of the eye. And you do that with both sides. Here are bathing methods. When you're washing the client in bed, the person's arm is washed with firm, long strokes using a mitted washcloth. The person's hand is washed by placing the wash basin on the bed. And the person's breasts are not exposed during the bath. A bath towel is placed crosswise over the chest area. The towel is lifted slightly to reach under to wash the breast and chest. And as you can see, the right hand side, the bath towel is turned so that it is lengthwise to cover the breast and abdomen. The towel is lifted slightly to bathe the abdomen, and the bath blanket covers the pubic area. Bathing the feet. The foot is washed by placing it in the wash basin on the bed. And bathing the back is washed with long, firm, continuous strokes. Note that the person is in a side-lying position. A towel is placed lengthwise on the bed to protect the linens from water, as you can see. Perineal care. Cleaning prevents infection and odors, and it promotes comfort. Perineal care is done daily during the bath. Whenever the area is soiled with urine or feces. Very important for persons who have urinary catheters, have had rectal or genital surgery, are menstruating, are incontinence of urine or feces, are uncircumcised. Perineal care, peri-care, involves cleaning the genital and rectal areas. These areas provide a warm, moist, and dark place for microbes to grow. Be sure to request the person's consent before performing peri-care. This procedure embarrasses many people and nursing staff, especially when it involves the other sex. The person does perineal care if able, otherwise it is given by the nursing staff. Standard precautions, medical asepsis, and the bloodborne pathogen standards are followed. Work from the cleanest area to the dirtiest. The perineal area is a delicate and easily injured. Use warm water, not hot. Rinse thoroughly, pat dry after rinsing. This procedure embarrasses many people in nursing staff, especially when it involves the other sex. Working from the cleanest area to the dirtiest is commonly called the cleaning from front to back. Draping the perineal area. A shows the position, the bath blanket the position is like a diamond. One corner is at the neck, there is a corner at each side, and one corner is between the person's legs. B shows you to wrap the blanket around the leg by bringing the corner around under the leg and over the top. Tuck the corner under the hip, as you can see. Female perineal care. You want to follow the direction of going front to back. which is so important for females because if you don't, you can cause a UTI, which is a urinary tract infection. UTI. So you want to separate the labia with one hand. Use a minted washcloth to cleanse between the labia and downward strokes. The rectal area is cleaned by wiping from the vaginal to the anus. The side lying position allows the anal area to be cleaned more thoroughly. Again, wiping from the cleanest to the dirtiest. Male perineal care. Your foreskin of the uncircumcised male is pulled back for perineal care. It is returned to the normal position immediately after cleaning and rinsing. Never leave the skin back. Always put it back down. Pull it back down because it can constrict and cause really bad problems. The penis is cleansed with circular motion starting at the meatus. As you know, you want to go one circle. Bathing continues with towel baths. The nurse and care plan tell you when to use a towel bath. To give a towel bath, follow center policy. Baths use a new washcloth for each body part. Let the skin dry, air dry, and you do not need towels. For a towel bath, an oversized towel covers the body from the neck to the feet. It's quick, soothing, and relaxing. And here you need to review the residents with dementia towel baths in the textbook. Bag baths use a plastic bag containing about 8 to 10 washcloths. They are moistened with a cleaning agent that does not need rinsing. These are often warmed in the microwave, and make sure you check that cloth before you put it on that person's skin because you are warming it through the microwave. Partial bath involves bathing the face, head, axillary, which is under the arm, back, buttocks, and perineal care. You give partial baths to persons who cannot bathe themselves. The rules for bathing apply to partial baths. You assist as needed, always. Here, the person is sitting on the side of the bath, and they're doing a partial bath also. The person is really bathing himself while sitting on the side of the table. Necessary equipment is within his reach, and you should, again, wash the back because it's hard to wash your back that way. Tub baths and showers, falls, burns, and chilling from water are risk. Safety is important. The person's privacy must be protected. A tub bath can make a person feel faint, weak, or tired. These are great risks for persons who are on bed rest. A tub bath is important also to have. The person may need one of these devices to help in and out of the tub. Check figure 18 to look at the tub with side entry door, a wheelchair or stretcher lift, or a mechanical lift. Never let weak or unstable individuals stand in the shower. The back massage. Relax muscles and stimulates the circulation. Are given after the bath and with evening care. Can be given after repositioning or to help the person relax. Last 3 to 5 minutes. Be sure to request a person's consent before performing a back massage. Observe the skin before the massage. Lotion reduces friction during the massage. Lotion is worn before being applied. Just warm. Look for breaks in the skin, bruises, redness areas, and other signs of skin breakdown, and make sure you report it to the nurse. To warm lotion, rub some lotion between your hands and place the bottle in the bath water, or hold the bottle under warm water. The back massage, as you can see on left side, the person lies in the prone position for a back massage. You want to stroke upward from the buttocks to the shoulders. Follow the arrows. Down over the shoulder, upper arms, back up the upper arms, across the shoulders, and down the back to the buttocks, as you can see. And then on the right hand side, it shows where you can knead the skin. It's done by picking up the tissue between the thumb and the fingers, gently doing that. And it's so soothing and it really makes you feel good when you have a massage. Reporting and recording. You make many observations while assisting with hygiene. Report and record the care given. If the care is not recorded, it is assumed that the care was not given. Review the hygiene observations to report and ones that are listed in the textbook. Bleeding, signs of skin breakdown, discharge from the urinary tract or vaginal, unusual orders, any change from prior observation. Also report and record the care given. If care is not recorded, it is assumed that the care was not given. This can cause serious legal problems. This is the charting system at one facility. Everyone has their own chart, so it can be different from one place to another. But you can see where you have the order, you have the time, you have the day from first to 31 to the 31st. You have 11 to 7, 7 to 3, 3 to 11. Hygiene, washing face and hygienes, you just put a mark to let them know. Like one is independence, so you can do that. The quality of life, provide hygiene in a way that maintains or improves the person's quality of life, health, and safety. Protect the person's rights when giving care. Privacy and personal choice, freedom from restraint, use of personal items. Hygiene is a very personal matter. Residents have a say in when and how hygiene is done. Personal choice is allowed in choosing products used, what to wear, and hairstyling. And this is the end of chapter 18 on hygiene. Make sure you study the material and pass it with a 70 or greater. You're going to do that. You're good. Thank you.